Hello, thank you for clicking on the video. I am John Fischetti, the orthomolecular representative for the western suburbs of Chicago, and I want to follow up with the previous conversation about the reintroduction phase, and that being helping your patients reintroduce their immune systems out into the community. Whether that be of an imminent threat that may or may not be out there, or this idea that your patients have been quarantining for the most part, their immune systems have not been exposed to the pathogens, microbes, viruses, bacteria that they normally would be in their place of work or place of leisure. So now, with that limited exposure, we're going to be coming back into the community, and we want to make sure and reassure our patients that they have the immune system or the tools to evaluate their immune system to handle these challenges. How do we do that? Well, a great topic that is, I know, a vague one, stress. I think stress, we can all agree, is at an all-time high for all of us, not only your patients, but you as a practitioner. There's a lot going on and a lot of uncertainty that has happened, and a lot of events, especially here in Illinois, that have led us to have a lot of stress. Now, a lot of my practitioners that I've been speaking with this idea have come back to me and said, absolutely, we know stress affects many bodily systems in the body, but where do we begin that conversation with our patients? And before I get into that, I'm a big proponent for reading. And so whether you buy this in a hard copy or like to download it and listen to it, I think this is a great read for everybody. It's Why Zebras Don't Get Ulcers by Robert Sapolsky. And if you're not a believer that stress affects many of the bodily systems or normally functioning systems in the body, I think he will elucidate you quite heavily. It's a great read. And really the big picture that I get out of it is stress needs to be in every conversation. More so, managing stress needs to be in every conversation and every thought process when it comes to our patients and our own health. The reason I think this merges really well with our reintroduction phase, if you will, is stress, as you know, affects the immune system, and our immune system being compromised is exactly what we're being discussed with this reintroduction phase. So I'm going to keep this short and sweet. There's three things I like to focus on when talking with my practitioners about how to have these conversations with our patients. The first is, can we identify at least a few areas of stress that we can start a conversation with a patient? And I would say the answer to that is yes, and I like to choose four. Four being inflammation, blood sugar regulation, our circadian rhythms or sleep patterns, and then lastly, our mental and emotional. If we can identify in those four categories with your patient where they're struggling the most, we can now open the door to the conversation of, this is an area of struggle for you, as you can see. Let's focus on this with our lifestyle intervention, nutrition, and then also supplementation as an add-on. The second being, how are you educating your patients? Do you have the materials to do so? Are you constantly creating information that's spending a lot of your time? Are you having the same conversations with patients over and over again? Maybe you need to do this in a group setting or a virtual platform. There's a lot of information out there. I believe someone said it best, a pandemic creates an infodemic. I believe that there's an infodemic always, just based off the topic of what you're looking for. And then the third being, how do we implement that? What lifestyle interventions can we put into play? What nutritional interventions can we put into play, that diet that falls into that lifestyle? And then lastly, again, on the supplemental side to add to. I'm going to share my screen with you real quick here to share some examples of resources that I think will be of value to you. First is from the Lifestyle Matrix Resource Center. There is a program called the SOS, Stages of Stress, or Stress Recovery Program. Why I think this is so important? I know a lot of my practitioners have spent hours creating PowerPoints and presentations and pictures and videos, etc. These are a lot of contents already developed for you. And not only that, but when you purchase this kit, there's an online portal now that will help you implement this kit and learn the ins and outs of each piece. These two areas here are meant for the practitioner. Whether you need a refreshment or to broaden your horizon on the stages of stress and HPA axis dysfunction, no longer only focusing on adrenal fatigue, This is a great resource to start or have on hand as a reference guide when you need a refresher. Moving into our implementation, we have our in-practice guide. This has a brief overview in the beginning, but then also allows you to look at actual case studies with lifestyle intervention, health histories, and also nutritional supplementational interventions, and follow those results to give you a foundation of where to start with a particular patient type. And then, as you know, you will apply your personalized lifestyle medicine with each particular patient. Then you have all of these resources to help you engage with the patient, whether it be an animated video to help educate them on stress overall, right? We no longer talk about maybe just one big stressor in your life, but possibly acute stressors going all the time. We can elucidate them on the difference between acute and chronic stress, highlighting off the video. We can send them home with a patient handbook, and we can prescribe different chapters for them to read to really figure out and tone in on what their key stressors are. Prescription pads to go through more images and information, etc. And then this is the most important tool I think that everyone should be utilizing, and I'm going to highlight it here for you. The most valuable tool we all have when it comes to conversations with our peers is questions. The best questions that you can ask will give you the best answers and the best insight to your patient's history and where you need to go from here. As I said before, the biggest question most of my practitioners have is, where do I begin? I would say here. You can send this questionnaire to your patient and you can help them identify, is it blood sugar dysregulation? Is it mental and emotional stress, circadian rhythms or sleep disturbances? Is it inflammation in their diet, possibly, or MSK, their musculoskeletal system? Now, once they answer these questions, again, best questions, it opens the door for conversation for you to highlight maybe, let's say, these two areas, mental, emotional, and sleep disturbances. Now they can see this is where I should be focused on, and you can plug in the gap with our lifestyle interventions, our nutritional habits, and then also our supplementation. These are some of the tools that I think will help you if you've never been interested in implementing an SOS program or stress program. These are a great way to get started, and I can help you along the way. As you probably noticed, I have a great reflection on my glasses here. That's because those are my blue light blocking glasses. I'll take them off now so you can actually see my eyes rather than reflection from the window and the screen in front of me. Thank you so much for tuning in. In the email, you'll also see more information. Have a wonderful day, and please reach out to me with any questions.